The time before the quarantine seems so long ago. Reflecting back a year ago, in late December, I recall anxiously scrolling Twitter with the hope of finding a small miracle that will put our country back together again. Our country is so divided. It makes me sad. As I scroll further, a short video of a young physician catches my eye. The doctor is video recording himself from a Wuhan Central Hospital, warning colleagues about 7 people who have a mysterious illness. He was videoing while in quarantine in the emergency department. Shortly after the video went public, he was silenced by the Wuhan government for being the first to warn about the deadly new coronavirus. Soon after, the physician came down with the virus, and by January 7th, he was on a ventilator. Less than a month later, he was dead from the coronavirus. Do you remember where you were the day the World Health Organization declared the coronavirus outbreak a global pandemic? And how did that make you feel? I remember that day because I was scheduled a home visit with a 2.5-year-old Hispanic boy with Down syndrome. This little guy cracked me up. He would often protest during certain activities with his mother. And with me, I would just sit there and say, "Are you ready? Because your cute little shenanigans probably aren't going to fly with Miss Jocelyn today. We're going to do some functional activities." And he'd laugh and giggle. His visit was always a pleasurable visit at the end of the day. A global pandemic. Those words weighed heavy. Finally, I made the call to cancel the visit. The child's mother was a medical assistant at a busy urgent care clinic, and I couldn't help but wonder if someone carrying the virus had stepped foot in the clinic that day. Later that evening, our governor announced the shutdown. Soon we would be in total lockdown. The lights began to dim on the strip. The casinos had gone dark and the boulevard streets were empty. I started to stress over people who were sick and losing their lives to COVID-19. I anguished over the fear that nurses and doctors were taking their own lives due to an inability to cope with the high daily COVID-19 death toll. With that came the worry of my new role as a virtual occupational therapist. I remember thinking, will the kiddos continue to make the same gains as if we were doing therapy in the home? The news was overwhelming. Now we must wear a mask when we leave home. For now, we are shut-ins. We must limit our time in public places, and those who go out should be the ones with the strongest immunity. And well, may the odds forever be in your favor. One thought kept coming to mind, and it stayed with me. It struck me with fear each time I thought about it. Should I continue to go out to the long-term care facility on a per diem basis, or should I relinquish my role at the facility? It's something to think about. Skilled nursing facilities are getting hit hard by this virus. And then I thought about my oath as an OT. Why would this setting be any different from any other setting? For example, if I was working in a hospital, I would have to don and doff PPE safely. And as healthcare practitioners, we would all take precautions, and it would be business as usual. This facility is no different. Since the pandemic, I have continued to work at this small, quaint, skilled nursing care facility. Hats off to Administrator Laurie, as well as our allied health staff for maintaining negative COVID test results for the past 6 months. Even when throughout the Vegas Valley, other large corporate facilities have had to shut down temporarily due to outbreaks resulting in lives being lost. Our facility has done well and has been in lockdown since March of this year. No visitors can come into the facility. However, family members can telephone or visit loved ones through their window. Back in July, our facility employees received their first COVID testing. In September, testing increased to 1 time a week. And currently we are being tested 2 times a week. As the COVID positivity rate continues to sharply increase nationally, sadly we are no exception. The last couple of weeks at the facility have been the most difficult. 2 weeks ago, 2 employees, as well as 3 residents, tested positive for COVID-19. 2 days later, 19 residents exhibited symptoms and came down with the virus. My heart sank. The nursing director quickly sectioned off the 200 unit with plastic sheeting and a zippered entryway. A physical therapist colleague and I were asked to evaluate the 3 new contagious patients. I desperately wanted to come up with some excuse to leave the facility, to never return. Instead, we cautiously entered the zippered entryway into the cold zone, where we donned our gown, cap, booties, gloves, N95 mask, and face shield. We then entered the hot zone. It's too late to turn back now. We have been exposed.